The scores under value-based purchasing are important because you need to be looking at not just what's going to happen in the future for your agency and reimbursement, but what you should be doing for the patient and the communities you serve. So in value-based purchasing, 4 areas that providers need to focus on for 2017 and 2018. They need to set their priorities and make sure that they're realistic priorities. They can't do 20 things at one time. The industry has a bad habit of having too many things going on. They need to make sure that based on their priorities and make sure they get their goals. It's really important that they set goals that are achievable, otherwise you're going to lose people very quickly in process. With value-based purchasing coming, they really need to make sure that they educate that staff to make sure that they understand what those processes are. And lastly, they need to look at their discharge OASIS, not just their start of care OASIS and coding, but also with their discharge OASIS. When you look at what happened with Medicare PPS starting in 2000, we've been 17 years in the process. Agencies have really focused on start of care OASIS and their diagnosis coding. Now what's happened within value-based purchasing, they're taking key outcome and process measures from the start of care OASIS and comparing it against discharge OASIS. So what agencies really should be focused on are the areas on those specific questions that are process and outcome measures to make sure they are comparing their start of care OASIS to discharge OASIS, and cases where an agency was the same or got worse in any one of those questions, they should be researching those charts to determine was it really the patient didn't improve, or did they not fill their start of care OASIS out correctly, or is the discharge OASIS incorrect? Because that really does affect the scores and the process and where they may get penalized or reimbursed higher from that process. When you look at value-based purchasing, the government's put this in place to try to reward higher quality providers. So if you strive to be a higher quality provider, succeeding at value-based purchasing is going to get you all the outcomes that you're looking for in other areas. So agencies really should not just look at it as a value-based purchasing as the gains or losses you can get through, but what should be doing in caring for patients, which is why home health agencies were in business to begin with.